banner advertising in its simplest form is a means of generating frequency with your customer, but it's not the be all and end all. It doesn't start and finish with banner advertising. It's all part of a larger integrated marketing communications plan.
Hello, Sam. I'm very happy to have you on the interview today. I welcome you, and maybe we start with a small introduction from you, so everybody can know who you are.
Yeah, sure. Thanks for having me, David. I'm Sam Bradford-Smith. I'm an executive director at Medscape. My background is in healthcare media. I've been on agency side, and now I'm on a supplier side of the healthcare advertising landscape, and been doing it for 8 years now, in either side of the fence, and really looking forward to our discussion this afternoon.
Great. So the whole discussion started because I'm an anti-banner person, and we had once a discussion about banner, and you went the other way, saying that there are a lot of cool things to be done on banners, and I think that's a hot topic right now in the pharma industry because a lot of providers actually try to recommend banners. A lot of agencies recommend banners. I haven't seen very often good results. So I think it's a nice topic for 2 days and for the first interview to actually dig into that and see how pharma professionals can actually better use banners if they even should. Let's see what comes out of it. So first, just to set the stage, how would you summarize in a couple of sentences why you believe banner advertising is actually relevant?
So it's a really good question, and I think digital marketers or marketers in general have to respect basic principles of advertising to create impact. You've got a potential universe of people that are going to be interested in buying your product or prescribing your products, and you have to remember basic marketing principles, like the rule of 7. You need 7 exposures to something to make sure before that message starts to stick with the end user. And banner advertising in its simplest form is a means of generating frequency with your customer, but it's not the be all and end all. It doesn't start and finish with banner advertising. It's all part of a larger integrated marketing communications plan, but it's a foundational solution that should be part of a marketing strategy.
And when you speak about 7 interaction, is an interaction somebody clicking with your clicking on your banner or interacting with it, if you can expand it, or is an impression already an interaction in your way of seeing things?
You definitely want to, an interaction is a net result of a banner exposure, and what I focus on primarily with display banner advertising is exposure to the messaging, because a lot of what happens, and you know this from the click-through rate reports you get from your banner campaigns, that if you get a 0.12% click-through rate, that's considered an industry standard benchmark, and that's miserably low if you think about the number of exposures to a banner that you might see. But there's a lot more to dig into with display banner advertising than the click on its own or an interaction that you can derive value from display banner advertising.
So how can you show the value if people don't click? Because I personally ignore the banners. I don't look at them. Eventually, for branded campaigns, I can see a value because you ignore them, but in the back of your head, you still see the logo or whatever, and you may recognize it. But how would you see actually also for a disease awareness campaign the value of banner advertising?
What you've explained there about sort of not necessarily engaging with the banner is but still at least acknowledging its presence and seeing a brand logo, that's the basics of advertising and marketing. But in terms of, and with branded advertising, the logo is always ever important, and so are those key messages. For unbranded disease awareness campaigns, you do want to try and elicit some form of action, but that's where you can develop creatives in a display banner format that generate more of an interaction within the page that a healthcare professional is interacting with that content. you've already talked about expandable banners as a means of generating engagement on the page where that banner is visible, and that's actually a really good way of leveraging display banner advertising for positive impact. And I'm sure we'll talk about this in some more detail, but you're able to actually extract better metrics from those forms of creative where there is expandable components, things that you can interact with within that frame of a banner that will be able to tell you a story beyond just a click of the value you can derive from a display banner campaign.
So just for the listeners who may not know what is an expandable banner, it's basically a banner where when you either go over it or automatically can expand to take a much bigger real estate. So you can take a full page, half a page, or something like that, simply by either scrolling on it or hovering with your mouth over it.
Yeah, exactly. And with that, you can that expandable real estate that you've talked about there is a blank canvas. So with that, you can integrate video. You can create questions, polling questions to extract some data from a user that's engaging with your banner, or gamify the banner and actually create an experience that lasts with the healthcare professional that's interacted with it. It doesn't have to just be passive reading content that they can experience within those creatives. HTML5 as a format for creating expandable banners is a rich source of technical capability that is, relatively speaking, untapped by pharma at the moment.
It's true that I haven't seen it often. So far, what I've seen is basically a small picture expanding into a big picture, and that's about it.
Yeah,
But
and they're not easy to build. They require expert capability. Creative agencies have teams that are skilled and tooled up to create these types of creative, and they do require a little bit more effort. But the rewards are there with them when you're able to deploy them.
And how many channels do you think we can use for this type of expandable banners? Because a lot of the medical journals simply allow you to have the standard small image, big image banner. I would imagine that WebMD offers these expandable banners, but do you see them in other places, or is it standard industry practice already?
So it very much depends on the publisher. Now, there are some medical journals, for example, that have very strict editorial guidelines and policies that don't allow advertising real estate to overlap or interfere with editorial content, and that's absolutely fine. There are other publishers, and ourselves included, but there's a wide range of publishers out there that do offer expandable placements, and generally speaking, they're no more expensive to buy than the standard ad unit sizes that you would buy on a CPM rate. The other costs you might have to consider are the technical capability needed to deliver those banners, because most publishers will need support from a third-party ad server, which is another layer of cost involved with it to enable that technical capability. But they are certainly there for that. Most publishers will be able to accept those, and it's worthwhile having that conversation in advance if you want to deploy them in your campaign.
So expandable banners is a solution for disease awareness campaigns. Would you see another way to use banners for this type of campaigns? So for the branded, I think we both agree brand logo exposure is already of value. For unbranded, beside these expandable banners, how would you set up a campaign with banners?
So it's a creative agency question, not a media agency question. But one of the things that you can use a disease awareness campaign to do it is traffic driving, and that's having one of the things that can sometimes be a failing with display banner advertising is lacking a very clear call to action. Having something that's very very a bold statement that it empowers someone to take a further action on the owned channel side of a display banner click is really powerful. And creating really strong visuals that actually capture people's attention is really important to extract the best value from display banner advertising. Having static images that don't don't move, don't animate in any sort of way, does sort of make them blend into the background and look like part of the page furniture. But if you create animated creatives that have a visually impactful sort of message within it, that's a good way to sort of start to draw engagement from, especially from disease awareness campaigns, because you have a lot more latitude to create impactful, challenge people's thinking and with messaging and imagery, much more than you can do within a branded environment.
Yeah, I've seen improvements when you actually do the banner correctly, which a lot of agencies are not able to do. Sorry to say that. Also playing with the colors, sometimes even going away from the brand color helps, because by going with strong colors, you can also attract the eye and so on. But with these type of things, you go from, as you said before, 0.1 as a industry click-through rate to 0.120, which is 20% improvement, but it's still almost nothing. That's why I'm not always fan. What I've seen work sometimes, and I'd like to hear what you think about it, is contextual targeting. So allowing banners to be targeted not to, let's say, all the cardiologists in a website, but to a specific topic and be related to this specific topic, which reduces very often the reach, but allow you to actually get to something much more relevant in the end.
Targeting is a really, really important consideration for display banner advertising, and context is super, super important for any sort of advertising placement. And, there's a lot of examples, if you don't have to Google very hard to find lots of examples of very bad contextual advertising as well. But media owners in the healthcare media space have done a very good job of providing a broad range of capabilities to target healthcare professionals to access niches of a specialty, behavioral targeting to find lung cancer oncologists out of an oncology audience, or targeting non-small cell lung cancer content within a medical publisher's website, so that your campaign has specific clinical context, which can help draw better engagement rate from those banners than perhaps doing a run of sight campaign on a medical journal that has all forms of oncology content within it. There's lots of different modalities to target display banner activity, all of which will have one benefit over another. It really depends on the style of campaign you're looking to execute, and how big or small your audience is. With primary care physician campaigns, you can afford to be broad in your targeting capability, because it offers you that they have such a wide knowledge base they need to keep on top of, that run of sight for PCPs works. Whereas for cardiologists, there's going to be very specific areas of medicine they want to keep in touch with. So you need to be more focused.
Makes sense. My next two questions are about trends or new things coming in. The first one is programmatic. This is fun and trendy. It's scary as hell for a lot of pharma customers, because they have no idea what that means, and they've got compliance coming behind them and said, "What? Programmatic? We don't control anything." First, can you explain what it is in a few words, and why do you think it shouldn't be so scary?
Programmatic advertising is it's essentially a form of advertising where you're able to literally program the parameters by which your advertising is displayed to an end user. What you're able to tap into with programmatic advertising is a much wider pool of availability with a target audience. So rather than advertising on specific clinical journals where there's basically a cap to the amount of visibility you can generate, programmatic advertising finds that audience wherever they're appearing on the internet. Now, with that sort of capability to program the targeting, you can set very, very clear criteria on brand safe environments, domains you do not want to appear on, which geographies you don't want to target or you do want to target, and even start to get more granular in terms of what time of day you want the campaign to be visible in, or what days of the week you want it to be visible in. Programmatic advertising literally is the ability to fine tune your approach to a customer. And it isn't just a a capability that can be sort of left in the consumer world, because ultimately healthcare professionals are humans, they are consumers, they are people that are navigating across Amazon, they're going to all the news outlets that they want to find out about what's going on outside their profession, and these all offer opportunities for you to interact with those customers in a coat off moment as opposed to a coat on moment.
And how would you know actually that these people are cardiologists or HCPs while they're actually shopping for something else?
So that's all based on the data layer that's part of the programmatic advertising platform that you work with. Now, there's two ways in which you can work with programmatic advertising. There's deterministic data, which is where you are able to generate a one-to-one match with an identified person over here is the impression you're buying over here on a programmatic trading platform. Or there is probabilistic data, which takes signals that have been sort of extracted from a user's interaction with a brand website, for example. So you've captured, if they've accepted your cookie policy on your site, you've captured their IP address, you've captured their device ID, and you can place those things within a programmatic trading platform and find impressions to that device or IP address and then target that user. Now, those two means of targeting in a programmatic environment have different degrees of accuracy. Probabilistic data gives you a 99% accuracy rating, but the potential is that someone's handing that device over to their child and you are placing an advert in front of a non-healthcare professional. Whereas with deterministic data, you know that person is the person that's receiving that impression because there's a one-to-one match going on. Now, from a compliance perspective, that does mean that Pharma will probably want to consider unbranded advertising with the probabilistic data as a means of exercising caution from a compliance perspective. But with deterministic data, you have a really robust understanding and security and knowledge that the impression you're delivering to a user is that identified cardiologist that you have over here from a data set.
Okay, I see. And another trendy topic is personalization. How do you see personalization with a banner? So with emails, it's quite easy. You know who has which interest. With banners, I imagine in the US, we can exactly know who has what type of interest, who's working where, and all that, so we can really personalize. But in Europe, where data is very limited, what type of personalization is possible?
So it really depends on the campaign you're trying to execute. Now, with certain platforms, you're able to layer on behavioral targeting to campaigns to identify customers who are interacting with specific types of content within their platform. So everyone who's targeting people who are looking at lung cancer content, for example, is a way of you can start to personalize the display banner campaign that's delivered to a set of users. There are ways in which you can also, and it requires complex campaign setup, but you are able to sort of set tracking tags on a brand site where you can monitor the types of engagements that someone's making with your content on your site. And then usually within a programmatic environment, you can serve ads to that person as they navigate around the consumer web, and provide them with a piece of content that follows on perhaps from whatever they've engaged with on your company site. It requires a bit more of a heavy lift from a content creation perspective, personalization, because you need lots of different variations and formats and to sort of provide that next best action. But personalization is something that is possible with display banner advertising, but it does require a couple of higher levels of thought and execution to enable it to take place.
I remember working at the IOC, and that was one of at the Olympic Committee. That was one of the big projects where basically the idea was to show a banner about Swiss events to Swiss users and a banner about UK events to UK users. And then if you like tennis, you're going to have the banner about Swiss tennis. or about UK tennis if it's really important, and things like that. And that makes that people are suddenly, it's like, oh, cool, they're serving exactly what I want. If we're able to get to this level in pharma, we can finally bring value with banners, and they're going to be less ignored.
And all that sort of level of granularity is still absolutely possible within the endemic environment. So the medical journals and medical publisher realm, it's about asking the right questions of the publisher you're working with to provide you with that capability to target at a country level, and based on preferences, if that's the sort of data that publisher is able to collect on its users. So it is possible, but again, you've talked about 4 different creative variations there in the space of 2 sentences in the IOC example. And one thing we know is that getting one set of banner ads out and approved and published can be challenging enough, let alone 4 variations. So that's the undertaking that you have with display banner advertising if you do want to get more complex.
Which in theory is still simpler than creating 4 different emails. Because if I do the same with an emails, I have 4 emails, which may be more difficult to create than 4 different banners.
Yeah.
Obviously, banners go with landing pages behind it, so it's more than only the banner. But
yeah, and then it's about how complicated you want to make the user journey, because what you can have is variation A/B testing of display banner assets, so that you have a quality of life message in banner 1, but you actually have your efficacy data in banner number 2, but they all lead to the same landing page. And what actually you can do within your landing page is you can set things like anchor links up. So when you click on the link for the quality of life banner, it takes you to that section of the website. And if it's the efficacy data, it takes you to that section of the website, and it puts you right where you need to be based on the call to action you've engaged with. But that can also be really, really insightful for you, because if you have 2 sets of creative running in parallel with one another, and you look at the engagement rates with them, and you can see that your QOL data is working much harder than your efficacy data, what does that tell you about your messaging? Your quality of life data is much more important for your customer than your efficacy data is. So how do you lean into that? Look at your site-side analytics. Where do they go once they've engaged that QOL data? Are they going to patient case studies to try and reinforce that with them in a patient-centric scenario? And then you've got yourself a customer journey you've just built out from display banner asset to what happens on the site, and that can be massively helpful for future campaign iterations, other strategic thought.
Yeah, that's really interesting, because we move into how to create a customer journey, which is often difficult from one channel to the other. But with this type of programmatic data, you can test value things on the same platform. I had planned 10 minutes. We're already at more than 20 minutes. I think we could go on speaking for a while. Do you have anything else you think could be interesting for pharma marketers that we haven't discussed that they should definitely know today?
I think one of the things that I would want to leave pharma marketers with is that display banner advertising shouldn't be seen as a necessary evil. It's part of an integrated campaign approach, because, like we said at the start of our discussion, it provides the baseline awareness and visibility for a brand at the top of the marketing funnel. You have the ability, with all your different targeting parameters, to find your customers wherever they might be engaging with your brand or willing to engage with it. And you draw them in further down the funnel with additional content in different formats, in different modalities, in your owned channels and your paid channels, that gets them down that conversion funnel, and you can create loyalists. But it all starts with having that broad reach, but targeted reach, that display banner advertising can help you with. And it can be a very inexpensive way of gaining broad reach quickly and visibility for your brand, especially at launch, and especially at the other end of a campaign, of a brand life cycle, at loss of exclusivity, but also in the middle.
Okay, thanks. Thank you very much, Sam. And it was a pleasure to speak with you.
Thank you.